Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.
Welcome to this edition of Community Health Matters. I'm your host, Kellie Davis. On this edition of Community Health Matters, we will be exploring behavioral health services and treatment offered by North County Health Services, as well as the Golden Years program NCHS offers. For our first guest, we are pleased to welcome Dr. Leon Altamirano, Director of Integrated Behavioral Health at North County Health Services. Hi, Dr. Altamirano. Did I get it right?
You got it. You got it.
Thanks for joining us.
Thanks for having me. Appreciate it.
So what is your role at North County Health Services?
I'm a psychologist and the Director of Integrated Behavioral Health.
Mm-hmm. And so we're just going to go right into a topic, the warning signs of behavioral health. So what are some of those?
Oh, I think you could split them up a little bit. Your obvious ones, people feeling depressed, anxious, maybe not being able to get out of bed some days, or staying in bed all the time but not sleeping. Some of those, it's really the ones that people don't really think about when they think about mental health or behavioral health issues that we look for, especially in primary care. Things like pain, frequent headaches, not being able to fall asleep or waking up quite a bit at night, lack of motivation, nervous eating, weight gain or weight loss without dieting. Some of these things really point the finger at people maybe picking up some behaviors that are just helping them cope with their daily life.
How do you know the difference between what might just be a funky time, or that you actually have some kind of behavioral health concern? I mean, is it over a period of time, or how can you identify that?
Usually it's progressive. It kind of slowly starts to ramp up, and we see people starting to struggle a little more, maybe some difficulty concentrating, a little bit more forgetfulness, irritability. You catch yourself snapping at your friends or family members a little bit sooner. Just lack of patience sometimes is really what kicks off that frustration, and usually it's an internal thing where we're just having trouble coping and functioning normally, and it comes out that way, a little bit of more frustration and lack of tolerance.
So hearing what you said, is it safe to say it's like maybe a collection of sort of things?
Absolutely.
Or is it okay?
Yeah, it's a collection of things which is why NCHS is really focusing on having behavioral health embedded in the primary care clinics.
And if you have expressing the warning signs, if there is a family member, it seems like it's a very sensitive topic. How do you address a family member that you feel?
Most people feel that way. It's a sensitive topic, and they try to stay away from asking about feelings, or the worst case, asking if somebody's been thinking about killing themselves. But the reality of it is it really shouldn't be. We talk to our family members about all kinds of stuff, lots of very personal things, and in context, when it's not a problem, most families will talk about just anything, really. So it's really important to be able to recognize that if somebody you love is struggling, that you really have to force yourself. It's your own issue and fear of asking, and you have to be able to just ask the question, how are you doing? You seem like something's been bothering you. Simple questions, but it starts the conversation, and that really is what helps folks who are struggling the most.
So what kinds of behavioral services in that case does NCHS offer?
Really a broad range. We, depending on which clinic you go to, I think we've got 11 locations across San Diego County and in Riverside. And so each one of our behavioral health providers has a little bit of a different specialty, but we have folks that work in our pediatrics departments with all of our pediatricians, so child and adolescent and teen issues. Some of our therapists work with our adult population, more cognitive behavioral health, anxiety focus, or all of them, top to bottom, are very skilled in working with folks who've experienced trauma. And I say that thinking having difficulties throughout their life. And really, trauma itself doesn't have to be this magical thing that only happens to a few people. You don't have to live in a war zone to experience traumatic events. When our brain's developing, we experience these stressful events that really result in us experiencing all kinds of conditions in adulthood, especially when our brain is developing from birth to about age 18 to 20. So we ask about history to help us understand how did this person's brain develop, and it maybe explains why they're experiencing things in adulthood. Aside from that, we have a women's health department, and we have behavioral health providers there as well. So we really want to capture folks before they have kids, break cycles of patterns of behavior, whether it's domestic violence or substance abuse, or these things that really impact children and their ability to develop normally, their ability for their brain to develop normally. So starting it, with pregnant parents, then kids in pediatrics, and then folks in adults and our elderly population.
So when you speak of breaking cycles, is that a cure? Or, is there a cure? How?
Well, everybody wants a cure. When we talk about things like that, we end up with everybody chasing that cure. So, that's really one of the reasons behind our major challenges with addiction in this country. Everybody's just trying to get a little bit of relief, and that relief is usually first alcohol or people getting high. Lots of people with pain get stuck with the pain medications, other medications that are for anxiety. They're highly addictive, and so people want that crutch. They want to feel good right now, versus actually getting into therapy, figuring out exactly why all this is happening, and then moving beyond it. Of course, there are some conditions that they're biologically based. People are going to need medication, and we can help them live as best as they possibly can. Wouldn't call it a cure, but many patients who do require medications on a regular basis, they stabilize, and to them, it really is. So it's really more about the individual.
What advice, we got about a minute, would you give to a family member or a person that might have a behavioral concern?
In less than a minute, talk to somebody. Ask questions if it's somebody you love. If it's you, talk to your primary care doctor. Seek out the advice from a psychologist or a therapist. Just ask the questions, get yourself more educated, and figure out a way that you can change some behaviors and start living healthier.
Thank you, Dr. Altamirano. Next up, we have Dr. Shayna Walker, Director of Behavioral Health, joining us right after the break.
Flu season is here, so now is the time to consider getting a flu shot to help reduce your chances of catching this season's flu. According to the U.S. Department of Health and Human Services, the flu shot is the best protection against contracting the flu. The cost of a flu shot is often covered by your health plan. Check your benefits documents and with your health plan and schedule an appointment today by calling your physician or visiting your local pharmacy or convenience care clinic. Many employers also offer flu shot clinics in the workplace. For more information, visit flu.gov. This message is brought to you by United Healthcare and this station.
Welcome back to this edition of Community Health Matters, exploring behavioral health services treatment at North County Health Services. Joining us now is Dr. Shayna Walker, Director of Behavioral Health at North County Health Services. Welcome, Dr. Walker.
Thank you so much for having us.
What is your specific role with NCHS?
Well, I first joined NCHS as a family medicine provider and a psychiatrist. I'm double boarded and trained in both aspects to take care of the whole person. Now I've stepped into the role of behavioral health director, and I'm doing behavioral health services for the entire organization.
Wow, that's a lot. You must
exciting.
You must have busy days.
Yes, yes. This is a fun day.
So what are some of the conditions frequently associated with treatment at your clinic?
Absolutely. We see the gamut of spectrum of diseases. I think, and I think it's important to know that they affect everyone, whether you have $1 million or $1. Behavioral health can affect multiple people. So we see depression, we see anxiety, and there's different types of disorders within those kind of major categories. We take care of some folks with severe mental illness who have psychosis or other long-term chronic psychotic disorders, and we manage that too with a lot of support from their family members and other services.
Now you mentioned when you started, you were you said medicated. Could you give me that
I'm
word?
a family medicine doctor. Take care of delivered babies all the way up to geriatrics. So I'm trained to do that in addition to psychiatry and classic behavioral health.
So what is medication management treatment, and does the dissemination of this treatment vary for different ages?
Yes, yes. So medication management treatment are the classic medications that unfortunately we see a lot of commercials on now, the medications that are approved for depression or anxiety or for mood disorders. They vary. There's more medications now to target behavioral health disorders than ever in our history, which is very exciting that research is being done, work is being done to really help folks recover from these severe medical problems, which they are a brain problem, a medical problem. They're not, no one acts to feel depressed, no one wants to feel anxious. It's a problem, just, I think of it just like chronic conditions like diabetes or asthma. You have to manage it. You have to get help for it and integrate into a family setting where you get help with primary care providers, with therapy providers, with psychiatry providers, or people who prescribe medications for these disorders.
The Medicaid management treatment, as it fits into what you're saying, you assess could you speak a little bit about that?
Absolutely. So we do a full evaluation to figure out what we're treating, whether that's depression or anxiety or bipolar disorder or schizophrenia. We evaluate what we're treating. There's different medications that are approved for each of those disorders, and we are very safe as far as which medications will be most effective for clients, that they're going to improve their quality of life, they're going to get them back to functioning, they're going to get them back to working and in school and all the things that we want for their lives, that people want for their lives, to be stable, to not fail out of school or not able to complete their work. I'm always looking at how can I get you back to your best functioning, because your life is you're not supposed to feel depressed for your life. You're not supposed to feel miserable for your life. So we want to get you back to that level of functioning. And medication sometimes with therapy have been shown to be the best way to do it.
So medication with therapy. And is there I don't know if the word is an end to the medication. Is it something that you have to constantly be on for the rest of your life, or can you get off?
It depends on the disorder and depends on the chronicity of how long a patient has had a symptom with that disorder. So for instance, if it's the first time a young client has ever had an episode of depression, we might treat for 6 months to a year and then take off medications. If there's been multiple episodes of depression or anxiety or something that's been long-term in that client's life, I want to keep you in a maintenance phase so we don't have recurrence of symptoms. So I want to keep you on medications to keep you stable, safe doses. I think we never want to hurt anyone. The goal is to help, never to hurt. So if the medications are hurting you, it's never our intention, and I think having a comprehensive team of folks where we have therapy, we have psychiatry, we have all the pieces in place, we can really get you to the best level of functioning. And I think we do that well at North County Health Services.
So, because you mentioned young people, so does the Medicaid management treatment, does that differ? How does that differ for the younger people? And when you say younger people, what is that age group you're kind of identifying?
So we take care of children all the way up to, I have 80-year-old patients as well. I think for children, there's just a lot of evaluation, family support, therapy support that we want to involve. I think that's for every age, but we're even more cautious with our young folks who are under 18 years of age, talking with the family members, making sure they're on board with what we're treating them with, and just being more proactive with, let's make sure we're increasing their functioning. Are they going to school? Are we doing alternative ways to get them their education, to get them successful?
So when you talk about this medicated management treatment, are you curing? Is that the right word? I used it before. I'm not sure if that's the.
I think it's resolving a medical concern. You know, think about diabetes. That's why I always bring it back to primary care. If diabetes sometimes cannot be cured, but it can be managed really well, where people don't need medications. That might be where we end up with behavioral health disorders, where they might still see me. I'm not prescribing any medications, but we're checking it. I want to be that net for them in case of something happening. We want to be the support system long term.
And how important is screening and integrated care for patients?
So important. I'm from the primary care world. I know that's the first point of contact where patients will say something, whether it's a physical symptom, I can't sleep, or I'm having stomach upset, I'm having chronic headaches. Those are the initial warning signs that our primary care providers are doing the majority of behavioral health treatment in this country, and they are the first line to screen and get folks engaged into care.
Are there any other kind of alternative treatments or therapy practices other than the medication?
I think there's a lot on the horizon, and it's exciting because a lot of these alternative treatments are being approved by insurance, which is very exciting.
That is exciting.
Like acupuncture and different types of therapies. We have a program for pain management. It's called neurofeedback at our organization. Where we try to decrease the level of stress related to some of the chronic medical conditions of chronic pain that can be linked to depression and anxiety. Light therapy, which just sounds, odd, but 30 minutes of sunlight in the morning can be just as effective as some mild types of treatment. So it's very exciting that a lot of these things are there. The gamut of what we want to serve for patients, the spectrum of what we want to kind of target and help patients with, we go outside the box for each patient because every person deserves to feel better.
So right there at North County Health Services, there's alternate treatments available?
Absolutely.
Oh, that's awesome.
Absolutely.
Well, Dr. Walker, I want to thank you for joining us today. And when we return, we will have our last guest, Luzmam Vigil, who will be speaking about the Golden Years program offered at North County Health Services.
Kids will spend 15 minutes watching online videos like this one.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes twice a day. They have the time.
Welcome back. And we have joined us Luzmam Vigil, Community Engagement Manager, here to talk about the Golden Years program offered at North County Health Services. Luzmam, thank you for joining us.
Thank you for having me.
So what is I gave the title, but what is your role at North County Health Services?
So basically my role as a community engagement manager is to get to know my community, get to know the needs that they have, and hopefully be able to help them with that by bringing resources and services to them.
So one of those resources is this Golden Years program. What is that? Can you tell us a little bit about it?
Yes, of course. So Golden Years is a support group for individuals that are suffering a behavioral health issue. It could be for their family members as well, so that they can know how to support that individual. What we do is we provide support for them, not necessarily counseling, but it's just a support system for them where they can come once a week, meet with other individuals that are suffering the same behavioral health issue that they're suffering that come from the same culture, that speak the same language as them. And then we also have a senior community liaison that works with them directly on an individual basis, where she provides more of a one-on-one support for them. So if they need support with housing, we'll give them that information. If they need food, we'll connect them with food resources.
That's outstanding. So when I hear golden years, I think of the Golden Girls. Is it specifically for older people, or is it?
Yeah, well, not anymore. It did start, this program has been existing for over 10 years. And originally it started for the senior population because they saw that there was a need for them. However, as the years have gone by, we know that the behavioral health issues not only affects the senior population, but all ages. And we still kept the name because we love that name, Golden Years, and everybody that has been with our program kind of identifies with the Golden Years. But we have expanded it to allow other adults as well. So not necessarily 65 or 60 years of age and up, but anybody that needs that support, they can come.
So I'm very curious about the programs and the activities you offer. Is treatment the right word for it?
No, we don't call it treatment because we're not licensed. We have our behavioral health consultants, our psychiatrists internally at our clinic that have all the requirements for licensing, and they're the ones that provide the therapy and the treatment. This is more of, it could either be the first step for an individual. Sometimes they are suffering from something like depression, anxiety, and they're still not ready to see a psychologist or seek treatment, and this could be the very first step. And once we identify that this individual needs additional support, then what we're able to provide for them, we could connect them with our providers. And this could also be as a complement to somebody that's already seeking treatment. Mm-hmm. Or it could be the final step for somebody that they're already finished with their treatment, but they still need that little push. And this gives them the opportunity, like I said, to connect with individuals that are going through the same thing, so that they know that they're not alone, and that it's okay that you're not having a good day, but you're gonna survive. You're gonna be able to get out of that, whatever it is that's affecting you.
Some of your colleagues who were on the show had spoke to, advice for someone, or if they know someone that might have a behavioral health concerns. And so it sounds like going to this Golden Years program without necessarily a doctor recommendation, you can just come in off the street, really?
Yes. It is open to the community at large. We are a North County Health Services program, but you don't have to be one of our patients to come, because we know very well that to take that first initial step to seek treatment, it's very hard. So we're not going to turn you away just because you're not one of our patients.
That's fantastic. So can you share a little, maybe 1-2 activities that what's a typical activity?
Well, every week it's very different, but we try to bring presenters from other agencies to talk to them. Over the years, we've invited the fire department to talk to them about senior safety in case of a disaster. We've invited insurance providers to come and talk to them about how to qualify for Medi-Cal and Medicare. We've also had the Elizabeth Hospice come in and talk to them about their options for end of life. So we want to have them to be
options for, I didn't catch that.
End of life.
End of life, so passing on.
Yes.
This,
Yes.
Okay, and who do you have? I've never heard of this program. You have someone come in to talk about.
Yes, and that's an external agency from Elizabeth Hospice. So we try to bring as many resources to our members, and that happens on a monthly basis. Besides bringing external resources and information for them, we have fun activities like our annual fashion show, which is an opportunity for them to dress up, feel glamorous, and boost their self-esteem.
That is awesome. A fashion show, and I guess relating to behavioral health, I mean, I'm sure that putting an outfit on, walking on the stage, does that do something?
Yes, it does. We have individuals that's the only time of the year where they get to dress up and they get to wear makeup, and unfortunately we don't have the funds to pay for their outfits, but we do bring in volunteers to help with the makeup and the hair. So it's just so wonderful, and they're able to walk and show their family members that, you know, they still had it.
That's good. What support can this program offer? Besides that, is there any other services that that the Golden Years provides?
Well, like I said, you know, a lot of resources and services that are available for them. So at North County Health Services, we want to be more than just a medical provider. We want to be able to connect them with resources out in the community, and again, you know, that individual support and connecting them with their peers.
So you talk about support. So what are some of the issues that a person coming to the Golden Years face?
A lot that we see is, besides anxiety and depression, is the feeling of loneliness. They come from a different country at times, they speak a different language, and to integrate into mainstream America is kind of hard for them at times, and this gives them an opportunity to know other individuals that have the same issues that they do, that they came as an older adult, not necessarily when they were teenagers, so they didn't get to experience living here as a teenager, so they're coming from as an older person. And you know, sometimes it's good to talk to somebody about your roots and to keep some of your traditions, and that gives them an opportunity. We celebrate La Posada, we celebrate a variety of holidays, not just the typical Thanksgiving and Christmas. We do a lot of things.
So there's a particular demographic that seems to be utilizing the services a little bit, and who are they?
Right now, we are working primarily with the Latino population.
And if someone would like more information about your program, how do they get that? Who do they contact?
They can go on our website. We're listed under community programs. You'll see a link to the Golden Years program, or they can call me directly or email me.
Okay, and just give me, they'll probably put it, but your email address is?
Yes, my email address is Luzmam. It's L-U-Z as in zebra, M as in Mary, A as in Apple, and M as in Mary, .vigil@nchs-health.org.
Thank you for joining us, Luzmam. And thank you for watching this edition of Community Health Matters Behavioral Health Services at North County Health Services. For more information on any of the services North County Health Services provides, please visit nchs-health.org. Thank you for joining us on this edition of Community Health Matters. Please be sure to join us again.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.